you. Thank you so much, Ada. Thank you for those housekeeping tips. And good afternoon, everyone. We're so excited that you've joined us today. In addition to expressing our thanks to Valencia College and the Creating a Resilient Community planning team, we're so excited to have you join us today to learn more about service navigation. I'm joined today by two amazing ladies. They are with the Department of Children and Families. They are the circuit administrators for their respective judicial circuits. So first and foremost, I want to identify our local champion, Miss Tina Morgan. She is the Circuit 9 Community Development Administrator. And our other champion is Miss Joelle Aboytes. She is the Circuit 5 Community Development Administrator. Both are with the Department of Children and Families. I am so excited to be joining them today to share this information with you. So no matter if you are brand new to your position, if you're a seasoned professional, we feel that we've got information that can help you in your efforts to serve those who may be in need. What we're going to do today is go over a whole bunch of information. And Joelle, let's go ahead and go to the next slide so we can review our agenda. Because on our agenda, we're going to give you some background information about the Florida Children and Youth Cabinet. This cabinet is the governor's cabinet for children, and it's the highest level of state government that focuses on children and youth needs. So we're going to talk about a lot of the work that they have done related to our agency prevention services. What are the goals that the cabinet has? How are the agencies doing that? How do we look at some public health topics, and how does that play into all that we're doing? But we're going to take a broad stance and really begin to narrow down to a point where we really look at who are those people such as you who are working directly with children and families. And we have some tools that we feel can be helpful to assist your efforts in resolving challenging or complex needs that children may experience that you may encounter, right? So we want to talk to you about some steps that you can take to help navigate systems, but more importantly, get the help that the kids and the families need. So again, we got all kind of information. And of course, before we wrap up, we will have an opportunity for comments, questions, and answers. So please use the chat or the Q&A tab for this session so that you can document. And again, as we wrap up, we'll get to that to ensure that we can have some dialogue around what's going on. So let's go ahead and get into the mix here, Joelle. So our Florida Children and Youth Cabinet was actually created back in 2007. And as I mentioned, it's the governor's cabinet for children that focuses primarily on promoting interdepartmental collaboration and program implementation. What you see there in the image are all the different child serving agencies in our state that come together as a part of this cabinet, along with other government entities. And the goals of the cabinet are to improve health, safety, economic stability, self-sufficiency, and quality of life. So let's kind of go to the next slide and see, what does that mean to our agencies? So what we provided to you is a perspective of all of the 8 child serving agencies in our state. They are all providing prevention services, right? Whether it be primary, secondary, tertiary, they're all doing that, and they're doing it from prenatal through the successful transition to adulthood. So as you look at this, each agency has their own outcomes and priorities that they're looking to achieve. And as they work towards that, those collective efforts of each agency rolls up to support our children's cabinet goals of health, safety, quality of life, economic stability, and self-sufficiency. So we wanted to provide this perspective because for many of you, we may be working with kids or families at different ages of their life course, right? And based upon their age or the stage within the life course that they're at, that may predicate some of the services we may be able to offer to put them on a pathway where they can become productive and self-sufficient. Next slide. We wanted to also introduce you, if you're not familiar, to the term social determinants of health. This is a public health term that looks at the conditions within social, economic, and physical environments where we live, work, play, and worship, age. And those aspects, those conditions impact our health and the health of our community. So what we see here is the 5 domains of what we call social determinants of health. And this was predicated from the Healthy People 2030, the World Health Organization, along with the CDC. They identified these 5 domains, and underneath each domain in parentheses are the goals of our children and youth cabinet. So the reason why we wanted to share this slide is to show the connection that the goals that the cabinet has aligns directly to the 5 domains that worldwide people are looking at as key factors to promoting a holistic approach to serving children and families. So as we look at this image in this sense, we now want to show you what it looks like when it comes to our agencies in the state of Florida. Where do they fall when it comes to these 5 domains? And we've provided a perspective here that represents kind of the roles that agencies play related to each of these domains. Please note, though, that while one agency may have a primary responsibility in one of these domains, they certainly have a vested interest in the other domains, which speaks to why the collaboration amongst our agencies at the state and local levels is really critical to our ability to support children and families. Next slide. So what are we trying to address through these domains? Well, we're trying to address risk factors. And if any of you participated in last year's conference, this image may look familiar because last year's keynote speaker was the woman who actually created this visual, and this is the pair of aces. I like this image because it speaks to the fact that, you know, in addition to experiences, we're also working to address community environments. And we know that there's a connection, right? And we also recognize that at many times, child abuse, neglect, child maltreatment is at the root of a lot of these other ACEs that we are experiencing within our state and within our community. We have an opportunity to start making some headways to start breaking these cycles and putting people on a pathway where they can become productive and self-sufficient. So let's go to the next slide, Joelle. Speaking of productive and self-sufficient, let's look at this prevention framework. So our children's cabinet in 2019 introduced this prevention framework as a way of creating a universal perspective of what we are all trying to do. So no matter what agency, what system, what position you may hold, if you're in the business of serving others, generally speaking, we are all trying to put people on a pathway where they can become productive and self-sufficient, right? So if you start at the top and work your way down, that's how we're looking at this infograph, right? We're identifying the goal of productive and self-sufficient, and certainly looking through the prevention continuum to see how can we address risk factors and build protective factors that enable folks to be on a pathway where they can become productive and self-sufficient. Let's look at this top part of this graph a little more closely. So again, the goal's at the top, but we look at primary and secondary prevention. And what I want to draw your attention to is the last sentence under primary prevention, where we talk about promoting optimal health and prevent the occurrence of disease, injury, or disability. People have asked, well, why are you talking about disease, injury, and disability? Well, quite simply, when we think about disease, we're trying to address issues associated with mental illness, with addiction, with substance misuse. Those are diseases that can manifest as a result of adverse experiences, adverse environments that may lead people down a pathway where they may result in the development of these diseases. When we speak of injury, we talk about the whole array of forms of violence, right? Child abuse and neglect, domestic violence, human trafficking, suicide, bullying. I mean, we can go on and on, community violence. We're all trying to address that to prevent injury. And then when it comes to disability, what we know is that we are working to address issues related to emotional disabilities, behavioral disabilities. A lot of the work in the school system that our SEDNet partners are specifically focusing on to address, to keep kids on a pathway where they can be healthy and productive and self-sufficient, excuse me. I want you to also look at the bottom there at that green dotted line in the middle at the bottom of the page in the middle. Well, that dotted line represents court. because court is a determining factor whether or not someone becomes involved in our state systems of child welfare, of juvenile justice, or criminal justice, or they remain within the community. So let's look at the bottom half of this image to learn more about that. So again, at the bottom of this framework, you see the dotted line there. And again, that represents court, because court determines whether or not kids or their families may be involved in our child welfare, juvenile justice, corrections, or criminal justice systems. And then you see systems involvement. So one of the questions I've been asked is, why isn't mental or behavioral health systems identified here? And the reason why it's not identified here is because if someone needs those services, we want them to get those services before they become involved in child welfare, juvenile justice, or our correction system. When they're involved in those other systems, the issues, the challenges become more complex because you got more people involved in this person's life trying to help them get on that pathway. Below systems involvement, you see tertiary prevention, but one of the most important things I want to bring to your attention is transitions. Because if there's an area where I think we have an opportunity as a state and as local agencies to improve upon, it's in transitions. After we provide our services to address the needs based upon our system lens, how are we making those connections to those other systems and ensuring that whatever transition plans that we create are actually being followed? Because unfortunately, there are times where those plans are not being followed. So when those kids come back to our attention, many times we seem to be starting back from square one as compared to continuing to build upon the progress that those kids and their families have made. So again, this is our prevention framework, and the next slide will provide a different perspective of this framework. And what we're doing is we're providing kind of a side or horizontal view. So I want each of you who have joined us today, just take a moment as you see the continuum of primary, secondary, and tertiary prevention. Take a moment to think about, where do the services you provide, where do they fall along that continuum? Okay? Because with everything that we do from a prevention end, our goal is to build protective factors that can mitigate against those risks that put people on a pathway, and certainly transitioning to be on a pathway where they can become productive and self-sufficient. I also want to bring your attention to the strategies that we are identifying below, because these strategies are very basic but are universal to our efforts of promoting prevention. The first one to the left is education to empower. Today, we are offering you education to create awareness so that you can be more informed about what we're trying to do here. And then as I pass it to my colleagues, they're going to talk to you about kind of the way to put that education into action, and even talk about some intervention opportunities as well. As you look further down the strategies, we know that when you become systems involved, we need to offer you some treatment to intervene in your life since you're unable to do that yourself. And certainly we want you to be on a recovery pathway where we can reinforce those positive messages that keep you to be on that pathway where you can become productive and self-sufficient. That's what we all want. We're all trying to do it. So we use this framework as a guide to assist us in breaking down our discussions and building them back up to identify strategies and solutions that can keep children and families on that pathway to becoming productive and self-sufficient. Joelle, next slide. I talked about protective factors earlier, and here's the image that we wanted to share with you. To the left are the 6 foundational protective factors that we talk a lot about in the state of Florida. I can tell you that individuals who call my office with concerns or needs, one of the first things that I'm trying to do is assess where are they at with their protective factors, right? And if they're compromised in any way, what can I do to help them build those protective factors, knowing that when those protective factors are strong, the parents' internal protective capacities can be also strengthened. And when we think about protective capacities, we're talking about cognitive, behavioral, and emotional protective capacities. My colleagues work for the Department of Children and Families, and I think anybody knows that if there's a safety issue with children, the Department of Children and Families may be called. As a part of their assessment, they are certainly kind of considering definitely the protective factors, but they're also assessing protective capacities of these parents, knowing that if their capacities are compromised, along with other statutory requirements, it may result in the need to remove that child for safety reasons. All right. So again, we wanted to share these images with you. And if you download our presentation, I believe in the chat, we provided a Google Docs where you can download some of this information. We encourage you to do so because there's an infographic where these two items are attached to. And when I work with families, I usually give a copy of this to those families so that they can begin to conceptualize in their head, what is it that we are trying to do to help them? We are trying to help them build their protective factors and strengthen their internal protective capacities. Next slide. The last item I wanted to share with you is information about the social ecological model. What you see here on the left is a visual from the CDC as it relates to their model related to violence prevention. And then to the right, our Department of Health has also created this model around the social ecological model, but that focuses across the life course, right? And the reason why I wanted to share these with you, because hopefully you've heard of this term, but you maybe were like, well, I've heard of it, but I don't really know what it means to us. What it means to us is it provides us an ability to begin identifying the infrastructure for a system when it comes to how they serve a child and their family. So if you look at the individual level, if we're looking at the CDC version, at the individual level, that's where we're talking about the child and their family. And for many of you, you may be at that relationship level based upon your position, working directly with those kids and families, getting support at the community level from your organization, and certainly too, getting support at the state level through the agency that may provide funding. So this model is really key in helping us define infrastructure. So at this point, I'm going to pass it to my colleague, Tina Morgan, who's going to talk to you now about some of the tools and resources that have been developed through our children's cabinet to really support our frontline professionals in their work in serving children and families. So Tina, nice to see that you made the transition. Welcome, and it's all yours.
Hey, can you hear me okay?
Yes.
Awesome. Yay, we were having some technical difficulties. So thank you so much, Zach. So we're going to talk a little about this process framework here. Back in 2012 and then again in 2017, Cabinet had kind of developed establish this process for resolving complex issues with children who are served by more than one agency. To promote that understanding, they developed this tool, the process framework that we're looking at. This graphic helps us to identify escalation of cases and how one agency maybe can't resolve it and how they can move that forward. To help you better understand this process, we're going to start. I don't know how to enlarge it like Joelle did, so I'm going to have it's always fun being with people who actually understand the technology. So looking at the agency and school section here, this section is an agency sees a child and they have some sort of issue that's kind of developed. So they bring together their group of people.
Excuse me, Tina. I'm sorry. Unfortunately, from my end, I hear you fading in and out. Can you kind of come closer in hopes that your audio will sound better? I apologize for that.
So now you just get a picture of my ginormous head. Better? So looking at the far left of this infographic, you'll see that any agency or school that has a child that has some issues, they'll look at that, they'll use their own interagency or trying to problem solve the issue, then they bump it up to the next multidisciplinary. know that that's called by a lot of different terms, threat assessment team, at-risk youth. That next level within their agency, involving a few more people who know about the student and there to see possibly maybe have some other ideas for intervention services. If, however, it doesn't work here, there is another opportunity. So for the agency, local, there we go. The local review team is comprised of all of the different agencies that Zach had showed. Health, substance abuse, insurance. We all can come together with the provider as well as those the provider identified as having knowledge of the child and the child's kind of problem solve. We offer some expertise at our level. We offer some technical assistance. Hopefully through that we can resolve the child and the family. If not, however, there's another escalation process. The region bump that same issue up to that issue, seek assistance. And then if still unable to resolve, there's the state review. Bump it all the way up to the state review. So at any of these, full review team.
Hey Tina, so sorry to jump in. People are having a hard time hearing you still. For some reason, the audio is going in and out. Do you think that Zach could take us through the navigation while you try to, maybe you could just leave the session and come back and see if that helps resolve the issue?
Can you hear us any better now? Because we turned off her video.
I can hear you. Just want to make sure. Can you try to talk again?
No.
It's kind of like every other word, unfortunately, Joelle and Tina.
I'm going to try to leave and come back. And if that doesn't work, then Zach will take it over.
Okay. Zach, maybe you can just kind of jump in until they get back. Is that okay?
Yeah, sure. So sorry about that, everyone. I know it was a challenge to hear that, but what Tina was going into was an explanation of our Children's Cabinet Interagency Agreement. This agreement was started back in 2012, was renewed in 2017. And what it did is it required all of our child serving agencies to come together at a moment's notice whenever there's a child who's involved with or at risk of being involved with more than one system. And as Tina was trying to explain, that process framework is if you start to the left of that document, whenever there's a child who has an issue, that agency or school will try to resolve that issue the best way they can, right? To keep that kid if it's a school-based setting, to get the kid ready to learn so that they can achieve. In the event that those needs are unsuccessfully, that we can't resolve those needs, then we'll escalate it to a multidisciplinary team. Tina was mentioning that there's teams that those names, the multidisciplinary teams, are called so many different things, but all those groups are all designed to come together to resolve the needs of that child so that they can remain within the community and in the system we want them in. And what we know is that we want them in our education system. At that point is where, in the past, before we had this interagency agreement, at that point, when multidisciplinary teams came together and were unable to resolve that issue, that's where the problems would begin to fester, right? We don't know what to do. The issues get bigger and bigger. And the next thing you know, we have that Friday afternoon 4:55 emergency call that says, we've got a crisis and we need your help. So those calls would traditionally come straight up to the headquarters office, where we're all ready for the weekend, but now we have to invest time and effort to figure out this crisis situation. To mitigate that, our Children and Youth Cabinet created this agreement that established local, regional, and state review teams to be able to assist those multidisciplinary teams in the event that they were unable to resolve those issues. So as you can see through this visual, it's a clear escalation on how we can get complex and challenging case issues resolved through the collaboration of our state agency partners. What this really represents to me is that no kid in the state of Florida should be falling through the cracks because of the issues that they may have. That there's always another level where a local agency or school can seek assistance to be able to resolve those issues. And that process starts with a local review team. And I was excited to tell you that our champion for the Central Florida area is right here, Miss Tina Morgan. She is the one who can assist you if you're in Orange, Osceola counties to be able to resolve those issues. Her counterpart in, oh, there she is. There's Tina. So Tina is our champion. And what's great about Tina is that she and her counterparts across the state all serve as a local review team lead or coordinator, so that at any time an agency or school is having a tough time in resolving issues, they can reach out to Tina or to one of her colleagues across the state to say, hey, here's the issue we're trying to resolve. This is what we tried. We've been unsuccessful. Can you help us out, right? So what Tina will do right there is probably ask a whole bunch of questions. What have you tried? What have you been doing? Where's this? Where's that? And all those questions are to assess what can we do to support that school or agency in resolving the issue. Because in some cases, there's not necessarily the need to fully escalate it to that local review team. That local review team lead can maybe provide guidance and assistance to help you with making the right connections so that we can resolve these issues and keep that kid hopefully in the system of education, but more importantly on a pathway where they can become productive and self-sufficient. So this document provides us the points of contact for each of the local review team leads across our state. Additionally, what those leads do is collect a lot of data on the cases that do get escalated to them, where we are tracking patterns, trends. We are also tracking our abilities to divert kids from entering our child welfare, juvenile justice, and criminal justice systems, where we can actually identify some cost avoidance or cost savings associated with that. But more importantly, each of these local review team leads provide us information at the state level on recommendations on how can we improve our processes, our collaboration, as well as our communication. Next slide. Additionally, what our local review team leads have done in many of our circuits across the state is created what's called a local review team quick reference guide. This quick reference guide identifies key issues. So if you look there at the center of the page, you see the key issues around health insurance, education, being adopted, juvenile justice, developmental disabilities, mental health, substance misuse, and foster care. So what we've done here is identified the key points of contact within each of those different systems as a way of sharing this with our system partners so that each of them can become more familiar with who are the points of contact within the other systems. And certainly when issues do arise, based upon the involvement of that child, those agencies or schools can then reach out to the respective system partner to get additional perspective. So what's happening here is our local review team leads like Tina and Joelle, they are training their system partners within their circuits on who these points of contact are. And on the second page of this document that we didn't get to see is also points of contact for our Medicaid health plans, right? And shortly you're going to hear why that's important, but all these contacts are provided, and our local review team leads provide training and technical assistance to their system partners to ensure that they know who these people are. And certainly when issues arise, they can then facilitate the connection, hopefully get the help that they need to resolve the issue so that we can prevent the need for escalation to the local review team. Okay, so that's an overview of what I know Tina was looking to share. So we're now going to transition to our colleague Joelle Aboytes, who's going to really get into our service navigation worksheet. A lot of information here, but a lot of good stuff. So, and again, all this information is in the chat in a Google Drive document that you can download and access, and we certainly encourage you to do so. Joelle, go ahead.
All righty, so testing out the volume. Is this any better?
Sounds good here, Joelle.
All right, good deal. All right, everybody. So as Zach mentioned, we really want you to go to that Google Docs link. And if you're able to pull up this worksheet, this is going to essentially direct our path for the rest of our time together. So if you're able to put it in front of you, it'll help as we kind of walk through this worksheet. And also, another reason why you want to pull this worksheet out is because there are several embedded links within the PDF form that you will have access to that you can't necessarily tap on it from the PowerPoint. So you want to go ahead and download those either during or after our presentation today. And so why did we create this service navigation worksheet? So the why behind it all is because, as we heard earlier, many different agencies involved with families. We all each have our own missions, our own objectives and goals that we need to accomplish with children and families. And sometimes that does not always translate over to the other agencies. We all have our own missions and goals. Sometimes we may operate in a little bit of silos. And so we want to break those down and work more cross-collaboratively to meet the needs of families whole. And so what we've noticed and through our work with the local review teams is that both families and service providers, service navigators, boots on the ground, those helping families and children access services, we all get very frustrated trying to do so. We call one provider and maybe they don't serve or take the Medicaid plan the family has or whatnot. And so, we give the families other numbers to call and they get frustrated because they're not getting through. And so we wanted to essentially establish some basic ideas of where to start when you are helping a family navigate services. And so that's what the purpose of this worksheet is to use it to help navigate services and give you a starting point. And so when we look at the worksheet a little bit more in depth, we're going to start with the first top row, which are the preliminary considerations. And this is essentially our roadmap for the worksheet. So it summarizes essentially all of the different sections that we are about to go through. So I encourage you, as you work with families, and when you come across the issues and you have a family come to you and say, I have a child who is Baker acted, who's doing this, who's got that, who's having issues in school, that you can say, okay, I can refer back to this and utilize, 1 through 5, all these different steps and help get them through that situation. And so we're going to break this down as we go through the worksheet. And as we go along, I encourage you to ask questions in the chat. We have folks helping us do that today. And so we want to make this interactive. It is a lot of information in a short amount of time. So we want to be able to answer your questions that come up. And hopefully Zach will keep me on time today. All right, so moving along, we're going to start with health insurance. So that is the first section on the worksheet. And some of the questions that we want to start with are, does the child have health insurance? Now, the great thing in Florida, if you look at the charts information data, it does show that over 90% of our kids in Florida have health insurance, which is fantastic. And that is an awesome resource for us. So we'll talk a little bit more about that in a few minutes. The next thing you want to ask is, who is the legal caregiver to the child? Because we are going to need that person involved and at the table so that they're able to sign consents, consent for medication, consent for treatment. All of that is very important. And if we don't have that person there, it's going to be difficult to get any services for the kiddo. Next, we want to ask is, does the child have a pediatrician or primary care doctor? So oftentimes what we see is that children are working maybe with a CAT team or a wraparound team for mental health, and their pediatrician may not have much clue of what is going on with the child. Oftentimes that pediatrician is left out of the loop. So we need to close those gaps and make sure the pediatrician is also aware of what is going on with the child. Does the child have a serious or chronic health care need or condition? So, for instance, if a child has diabetes and requires insulin, that may impact psychotropic medication. So we need to understand, you know, if the child has any additional medical issues that could impact any type of meds or anything of that sort. So, and I would propose to you, let's go back and talk about health insurance in general. So I would propose to you that most of us probably do not think about our health plans when we're having or seeing someone experiencing a mental health or behavioral health emergency. You know, think about it for your own selves. And if you're not feeling well, or you have an accident physically and you need to go to the doctor, you're probably looking for your health insurance card, making sure you have that. So when you show up to wherever you're going, you have that card. But when it comes to mental health and behavioral health, I don't think we always think about health insurance playing a role. And, you know, I think most of us, if we have health insurance through our employer, we probably get that annual booklet that they send to us that tells us about all our great benefits, or each year we get to select our health plans. And I encourage you to really take a look at those and see what the benefits are offered by the plans. What extra benefits do they have to offer? It's the same thing for Medicaid, and we'll talk more about the Medicaid benefits. And I would venture to say, being in the child welfare field for over 16 years, I've had my share of collecting resource guides and great provider lists. But, you know, I didn't always think about, when I'm referring individuals to those providers, whether or not that provider was in that person's health insurance plan. So what happens? The individual may reach out to that place that I referred them to, and they're going to say, they're going to be met with disappointment, because they're going to say, guess what? Sorry, don't take your insurance. So where we really need to start is, first question, does the child have health insurance? Next question is going to be, what plan do they have? And we're going to talk a lot about Medicaid, but regardless of whatever plan it is, it could be private or Medicaid, the plans have some level of case coordination, case management within them, and they all have some level of that. So you could even try calling your own plan and asking them what it's called. So private insurance, it may be called different things. For Blue Cross Blue Shield, for example, it's called a community specialist. For Medicaid plans, and this is across all Medicaid plans, they're called behavioral health coordinators. So they are the individuals within the health plan that can help families navigate services. So guess what, everyone? We don't have to be the experts on, you know, what providers are in what plan. What we need to do is get the family hooked up to their health plan. And that could be the starting point for service navigation. And within the Medicaid plans, the behavioral health coordinators do amazing things. They will conduct an assessment with the parent or caregiver, and they will identify the needs for the child and help that family get connected, whether it be connected for psychiatric evaluations, counseling services, non-traditional therapy, further evaluations. They can do just that. And also, I want to mention, the Medicaid plans also have medical case coordination. So the parent can take advantage of both if that's what's needed: behavioral health coordination and medical case coordination as well. So we need to really work that up front and get families, help them get connected to their plans. And let's think about it as well. We have families that are very transient, and so they may be living maybe up north part of Florida, and what if they relocate down south? Hopefully they will still have their health insurance plan, and again, we can refer them back to their health plan for assistance with getting them connected to new providers in their area. We don't have to be that expert, because guess what? I'm in Central Florida. I don't know who's all down south. So I'm gonna definitely refer a family to their health plan to help them get connected. And we need to remember that health plans are a sustainable funding source for services. So listen, we have our fantastic grant funded programs that are available, but what happens when they go away? We need to remember that health plans are a sustainable funding source. And so we need to start taking more advantage of that. And my ask of you is to be thinking, at what point in my role can I build that health plan connection to the family? So the other thing that's important about that is we want to remember that working with the pediatrician is also very important, because we may have to go back to that doctor to request scripts or document medical necessity as to why a certain service is needed. And so working with that pediatrician is very important. If the family doesn't, and the child does not have health insurance, we want to maybe help them apply for health insurance or Healthy Kids, or maybe even Social Security. We have embedded links in the document for that. If they don't have insurance or they're underinsured, we also want to take advantage of working with our managing entities. And we have links in there for that, so you can locate your local managing entity. And we have some additional resources listed in there to also help support families. So health insurance is going to be our starting place. And if there's anything you walk away with from this session today, it's how important it is to work with that family's health plan. And so, like I said, we're going to talk a little bit more about the Medicaid plans. And so families have the right to choose their plans, and there are different health plans available depending where you are located in the state. And the Agency for Healthcare Administration regulates our Medicaid health plans. We have a variety of them: Sunshine Health, Stay Well, Children's Medical Services, United Healthcare, Simply. Some of those may sound familiar to you. And so, if a plan is not meeting the needs of the family, the parent can call choice counseling to swap out their plans, just like we have the right to choose our health plans. And what you should know is that there are some basic core services that are part of every Florida Medicaid plan. And so you see that on the slide in front of you. So things like mental health and substance abuse treatment, well child visits, therapy, transportation. I can't tell you how many times we come across families with transportation issues. And did you know that transportation is a benefit under the health plan. If they need to go to therapy, therapy appointments or for an evaluation and they can't get there, they can work with that Medicaid plan for transportation assistance to get there, because we don't want that to be a barrier for our families. There's also dental services that are provided under the health plans that families can also utilize. And like I mentioned earlier, all of the health plans have behavioral health coordination. And so we want to be tapping into that to help families get connected to services. So I mentioned, well child checks for children. So I'm going to talk a little bit more about that. And so that covers the EPSDT, or early periodic screening, diagnostic, and treatment. So children have a little bit more robust service provision under the Medicaid plans. The whole purpose of EPSDT is to assure that children receive early detection and care so that we can avoid greater problems and that issues are diagnosed and treated as early as possible. And so because of that, children, they get away, I would say, medical necessity coverage through the EPSDT process allows them to get a greater array of services. And so some of these behavioral health services that are listed here on this chart, which include targeted case management. So when maybe the family needs a little bit more intensive championing through the issues that the child is having, and the behavioral health coordinator in the health plan, that's great and all, great place to start, but we need, it's a little bit more higher level need. We may want to refer that family to targeted case management. There's also different behavioral intervention services that are covered, mental health and substance abuse screening services, to name some of them, or maybe even inpatient residential treatment might be needed. Rehabilitation services, vocational services, these things can be covered under the child's Medicaid plan. In addition to school-based behavioral services. So things like testing and assessments, cognitive and developmental, emotional, social, and adaptive functioning assessments, those things can also be covered under the plan. And so where we talked about Medicaid has some very basic core services that every Medicaid plan has, where they differ is with what you called expanded benefits. And so there may be some additional benefits that plans offer that go above and beyond what the core benefits include. So I have a chart here. I am gonna a little bit more. So for instance, to show you some examples of expanded benefits that the plans have, swimming lessons. We talk about water safety and how important that is, right? Swimming lessons are a benefit under some of our Medicaid plans. And you'll see here, the check boxes indicate which plans have that benefit. So plans like Humana Medical, Stay Well has it, and Children's Medical Services, and there's a couple others here that are checked. So I definitely encourage you to take a look at this. And again, this document is part of the Google forms that are available to you through the Google Doc link, so you can check that out. And some other benefits included here, one to name is housing assistance. So it's assistance with rent, utilities, and or groceries. I mean, how many families can we think of that could really take advantage of that? And so if that parent or the child has one of those health plans that has that checkbox, they could actually, call the plan and ask for help with that. Just another thing to mention, There are some specialty plans within Medicaid. So for special groups of children, for instance, I think one we probably all know is Children's Medical Services for kids that have some sort of medical or mental health condition that impacts their daily life. There's also a specialty plan for children in foster care. And some of their expanded benefits include transportation for non-medical needs, to visit siblings or get to work. They get 3 trips per month under our Sunshine Child Welfare Specialty Plan, or even transition assistance, $500 in transition assistance to help them transition into stable housing post-18. So again, we're not going to all be experts in what plan has what. So what we need to do is get the families to call them and talk to their health plan about what is available, because these things could be expanded tomorrow. And it wouldn't be on this chart. So we need to help make those connections. Additionally, on this chart, you'll see, trying to get back to the Zoom. Let's see here, a whole list of additional services listed here, such as home health, equine therapy, art therapy, and you see, some of them have check boxes and some of them don't. So I want to draw your attention to the middle here where it says these are adult expanded benefits. These services are only available for adults because what? They are already covered for children on Medicaid when medically necessary. So this whole bottom half section of this expanded benefit chart, it applies to all kids for all plans. So if it's documented by the pediatrician or the child's treating psychiatrist, they would have access to that service if it was deemed medically necessary. So again, going back and working with the health plan, super, super important. All right, I'm going to keep moving through our worksheet. That covers our discussion on health plan for the moment. If you have questions, please post them in the chat. And we're going to keep clearing through due to time. The next section of our worksheet is intensity of mental health and behavioral health services and past services and transitions. So after we consider, does this child have health insurance? Who's going to sign for the child? Let's get them connected to their plan. We want to know, okay, does this child already have a mental health diagnosis, or do they need to be evaluated to determine what the diagnosis is? And then what are the child's specific needs or challenges that may impact or influence services? I'll give you an example of why that's important. If you have a child who is nonverbal, very low IQ, and significant autism, that child's service and service array is going to look different from a child that is higher functioning. So we need to be mindful of what the child's specific needs or challenges are. That is going to impact what services we will provide or refer them to. Additionally, we also want to understand what services had been provided in the past and what were the outcomes, because the last thing we want to do is keep spinning our wheels with families where they become frustrated with us and say, you know what, I've already done this, it didn't work. So we want to be mindful of what was tried in the past. What were the transition plans or even discharge plans that were created as a result of those services, and what was the follow-up to be? So looking at that history and transitions is important. We want to understand if they've had school-based interventions already, prior child welfare contact. Maybe they've been on medication. So is it being taken consistently, the right dosage, the right type of meds? That is going to be important to consider. And we're going to look at the continuum of the mental health spectrum and help identify where does this fall on that spectrum. So We need to think of mental health and behavioral health as being on a spectrum. You have lesser intensive services on one end, and then we can work our way up to more intensive services. So I'll give you an example that hopefully will help you relate to that. So for instance, if you're having some sort of pain in your body, and I'm gonna say hip pain, for instance, you don't just go and have surgery unless it's some sort of emergency accident, car accident, stuff like that, right? So normally you're not gonna jump straight into surgery. You're gonna start where? You may start with your primary care doctor. They may refer you to a specialist, and then you're gonna go see the specialist, and they're gonna do what? They're gonna conduct an evaluation on you. They may give you some medication, steroid pack to help take down some of the pain or inflammation. You may do that and you come back and say, hey doc, it's not working. I need something more. So then they refer you to, so you do some weeks of physical therapy. And then you may come back and say, hey doc, it's still not working. And you've been trying some treatment out for a few months. And then they may say, okay, well, it's time for surgery. So you see there, we started with lesser intensive services and we worked our way up. We need to keep this in mind as we are working through our mental health and behavioral health system as well. We're gonna start with going to a specialist and evaluations and lesser level services. And so at the lesser intensive side of our spectrum, we have outpatient services. So things like counseling, getting screenings, assessments, evaluations, maybe medication management, that might be where we start. We may work our way up to more intensive outpatients, so working with some of our wraparound teams or our community action teams or CAT teams that have an intensive therapeutic component, upping the counseling instead of twice a week. Maybe we're looking at 3 to 4 times a week. Maybe we look at some additional in-home services. We also have on the continuum, there are crisis points, and we want to hopefully keep our kids out of that section of the continuum, that emergency crisis section. And we hopefully can use our mobile response teams to help us de-escalate some of those. Then at the far end, we may have inpatient treatment. So that's the top end of the service provision. And usually that inpatient treatment bed is super expensive. Typically for Medicaid, it's over $480 a day. And so before an insurance company is gonna authorize that, they're gonna wanna see what's been done prior to. They're gonna wanna see that lesser level services were attempted before we're getting to that level of care. And we also need to understand is that inpatient treatment is not placement. Oftentimes we are working with families and they're saying, this kid needs inpatient. And then it's followed up by our protective investigator who says, oh yeah, that child sure needs inpatient. And we have to then back the family down and say, listen, what else have you tried? What else has been done in the past? We have to establish the history to show that lesser level services did not work, and that is why it's justifying that level of care. And so looking at the child, what are they currently getting? Where do they fall on the continuum as far as what they're currently getting? And maybe that's outpatient. Well, does that match their need? What does their need say they should be on this continuum? Maybe that's intensive outpatient. We see that a lot, again, on the local review team when we're staffing kids, that kids are receiving one level of services when they really need a higher level. And so how do we get to those higher levels? We're gonna work with the health plans, trying to access the services through those plans. All right, so we gotta remember mental and behavioral health is on a continuum. And we're gonna carry that notion of continuum over as well as we look at the next section of our worksheet, which is systems involvement. And so here, you know, again, it would be impossible for us to be experts in every different system. I've been in child welfare for 16 years, so very fluent in child welfare, and I am pretty proficient in the language of juvenile justice and DJJ, and I do speak some DOE and Department of Education. So, but it's taken a long time to get there, and quite honestly, it's taken us 7 years to try and put even this worksheet together. So big learning curve here. And so what we tried to do here in this section is put the information you would want to know, questions you would want to ask if a child was involved with that system. Additionally, here you will see a lot of embedded links. We tried to list some additional resources. So we have some assessments listed in here as well that are either important to that system that help qualify for services under that system, or that you can obtain through that. And we additionally have some next steps listed at the bottom as far as additional resources or connection points within those systems that can help navigate that particular agency. So you may have families that touch multiple systems. And I can tell you through our local review team staffings, we've heard it from families. They say, I have so many people calling me, I don't know what end is up. So what do we do in those situations? You may have a child that's in school, has health insurance, involved with DCF investigation, and then also involved with DJJ. That's 4 to 5 systems right there, and they may need mental health support. So who is going to be that champion? I challenge you to help identify champions for families so they don't become so overwhelmed with our different systems. And that's another reason why a multidisciplinary teaming approach is critical when we have children involved with multiple systems. So we've listed some questions there that you may want to ask if a child is identified as belonging, for instance, to juvenile justice. So, you know, what is their status? Are they on intake? Are they on diversion? Are they on probation? That is very important because we need to know what end of the spectrum within that system they are on. Are they on the lesser intensive side of DJJ, or are they in the more intensive side of DJJ? That is going to also impact what evaluations and services are available through that agency. So we need to keep in mind this concept of continuum, and we're going to carry this through our discussion through the rest of the worksheet. And so, for instance, another example of this is education. So where does this child fall within the education system? Are they, not every kid comes into school with an IEP. That's a process. You have to start out with lesser, you know, sometimes with lesser intensive services, right? You might start with some accommodations, maybe work a 504 plan, and then work your way up to an IEP. And that has to be documented through an evaluation, a psychoeducational evaluation. So we got to remember this concept of, you know, where do kids fall within those systems? What end of the system for that agency are they in? And then what access to evaluations and services do they have through that system? We've also listed here our health insurance, again, just reiterating some of the stuff we already discussed about the families having the ability to make choices with their health plans, or see if their child qualifies for a specialty plan that may open up some additional service avenues for them. All right, and then towards the bottom of the worksheet, like I mentioned, there are some additional links down there within the systems there that you can help connect families to. All right, so I want to talk a little bit about out-of-home care options for youth with mental health and behavioral health. And I'm speaking about this for kids that are in the community, not necessarily involved with foster care. Okay, so these are our community kids for the most part. We've been talking about continuum. We're going to use that concept here as well. So when we think about, you know, where the child's needs are, and then some of our kids, right, the parent is just saying, I'm done. I'm not picking them up from the Baker Rack. I'm not picking them up from detention. I can't do it. I need a break, and we need a cool down period. So we don't always like to have kids come out of home, because I always feel like once they're out of home, sometimes it's hard to get them back to home. So, but there are times when we do need that cool down period. So where do we go when we have that come up? The first place that we're going to start is at the bottom here with our community respite placements. And these are our Florida network shelters that exist across the state of Florida. The bed availability for those placements change daily. So they could be all full today, but then by, you know, Thursday, they could have some bed openings. So the estimated length of stay is short term, it's 30 days. And we've listed some examples here, but they exist across the state, and you can look at those that are nearest you. And they do a lot of work with ungovernable, runaway youth. They are our go-to a lot of times when we have that emergency come up and the parent doesn't want to take the child back home. The next step up would be a mental health respite placement. So for kids that are a little bit too high needs to go to our community respites, we may want to look within our networks, and we're going to check with our managing entities to see if they have any short-term beds for youth with mental health needs. And these are also a short-term option. They're usually only up to 2 weeks. And we have some that are funded by our managing entity, Lutheran Services, that we are very grateful for, that they fund at the Meridian and Daniel Memorial. The centers actually is closed at the moment due to staffing issues. So they are a great resource, though, for those kiddos that maybe their mental health needs are too great and they can't go to the community respite placement. The next step up is going to be a behavioral health overlay services group home, or BHOS group home. So these are partially funded by Medicaid. The bed availability may vary. Estimated length of stay is 6 to 9 months, and they are for children at risk of mental or behavioral health. So we've listed a couple there. And so kids may start out at our Florida network shelters for 30 days, and we may have to look to transition some of them to a more longer term place. And sometimes this happens with our 17-year-olds. Next step up is specialized therapeutic group homes. So now we're getting into treatment. And we have to remember, these are treatment, not placement. And so this takes a psychiatric recommendation and documentation of lesser level services. And then the highest level of care is the statewide inpatient psychiatric placement, also known as SIP. It is residential treatment or inpatient, also funded by Medicaid, does require a psychiatrist recommendation, and these are not immediately available. Typically, they have to go through a whole packet and application process, and sometimes getting into those placements, the specialized therapeutic group and statewide inpatient, can take a month or two. So they're not immediate. And we need to remember that when we're working with families, so we don't give them false expectations. All right, so we're talking about respite options. Okay, and so on the worksheet, we have some of these listed. So for those instances where the parent is definitely seeming overwhelmed and there needs to be some like interventions going in as soon as possible to help salvage the child remaining in the home. We've listed some ideas here. Community aftercare programs. We can't forget that normalcy is a big piece for youth and children. So as much as we want to wrap the families with therapeutic interventions, that's great. We need to do that, but let's also try and get the child involved with any other extracurricular activities or hobbies, things that they can feel a sense of worth to. So working with camps or faith-based programs, whatever we have in our communities. And that's also going to be important for our children under 10 years old, because there are not a lot of places those kids can go out of home. They're just too young. And so for those children, we need to be looking, again, extracurricular activities. What in-home type services can we get for them, whether it be through our child welfare system or, you know, working on the medical side with home health. Can we get that child involved in some sort of play therapy or non-traditional therapy? Or we may also want to look at our Safe Families Florida options that are available throughout the state. What other informal supports do we have? Do we have relatives around or non-relatives that can help with care for the child on the weekends? And I do want to call your attention, the form does have an embedded link for a healthcare surrogate power of attorney form, which you know, we see most power of attorney, they cover travel, enroll the child in school, that sort of thing. This one has some additional provisions to allow for signing of psychotropic meds. We talked about our Florida network respite shelters. I'm not going to go through those again, or our mental health respite, but I do want to mention we've also worked with our health insurance plans to get some home health, or what's called personal care assistance, involved. So families that need that in-home support, that could use a little bit of a break, working with the health plan, getting the documentation from the doctor to say home health is needed. I typically thought of home health for when they had a medical issue, but it can also help for children with mental and behavioral health. Longer term respite options, we talked about informal supports. Maybe they can go longer term through the summer coming up, planning with other family, maybe working through our Florida Association of Christian Child Caring Agencies. They have group homes that are faith-based and religious exempt that are out there, and possibly a resource. There are therapeutic boarding schools out there that some take scholarships and have low cost to families. We talked about the behavioral health overlay services, or BHOS. We talked about special therapeutic group and SIP already. Those are longer term, out of home, more treatment-based options when you're getting to specialized therapeutic group and SIP. So you're gonna need a lot more documentation to get there. And so when all of this has been considered, and when you know, you've tried to work through the worksheet and navigate following the guidance that's provided, when things have been exhausted, then we refer to the local review team to pull things together. But just remember, you know, I encourage you to call and cross-collaborate with different team members. If they're involved in other systems, get them to the table as early as possible. You don't have to wait for a local review team to do that. So I encourage you as well to do that in your system, or identify the points that you can have more interagency collaboration. Right, so we are down to our question and answer.
Wow.
I know I went very fast.
Joelle, thank you so much. And Tina, thank you for trying. Unfortunately, your microphone was going in and out. We missed that opportunity to hear directly from you, but thank you both for that great information. We know there's a lot of information that was just covered. In the chat, we did include the link to the Google Drive documents. We encourage everyone who's joined us today to please consider downloading those. We feel that once those materials are in front of you, a lot of this information that Joelle spoke to will hopefully make a lot more sense. But Joelle, we had a great question as you were talking, because while we have emphasized the health plan so much, what happens when a child doesn't have health insurance? What do we do at that point?
Yes. on the worksheet, we have identified some things that can be done. And so number one, we want to apply. So we want to find out why they don't have health insurance. Is it an income thing or what is going on? So at least having them try and apply would be kind of the first step. And then also connecting them with the local managing entity because that is for underinsured and non-insured folks. So they are kind of our safeguard to help families. So I would definitely say start there.
Awesome, Joelle. Thank you so much. Tina, is there anything you would like to add, or are you in agreement with Joelle?
Gave me a thumbs up.
All right. Yeah. So Ada, again, great question, because certainly our emphasis is around really accessing the health plan to be that starting point for families to assist them in navigating their services. But certainly we know that there's a segment of our population that doesn't have health insurance. So as Joelle mentioned, one of the first things we want to do is get them connected, right? Let's understand why they may not have a health insurance. Certainly we can articulate why there's value in it. And certainly we provided hyperlinks on the actual form to assist folks get directly connected to where information is about accessing health plan information. But also, too, as Joelle mentioned, our local managing entities are really a key resource for us because they can go ahead and begin to implement some services while the family may be awaiting confirmation on insurance. We don't want to wait, right? We want to get the ball rolling because we know that the earlier we can resolve the needs of this child, and certainly for the family, we hopefully put them on that pathway where they can become productive and self-sufficient. So Ada, again, thank you so much for that. But let's hear from others, right? Please consider the chat or the Q&A tabs on the top right part of your screen. For anyone that has any questions, comments, anything that you would like to know, because again, we know we just gave you a water hose of information, and we hopefully you aren't drowning, right? We want to be able to provide you a lifeline to pick you up and to further respond to any comments or questions that you may have. So, all right, Julie, thank you so much for your comments. We appreciate it. We knew it was a lot of information. Hopefully you'll have an opportunity to kind of let it soak in, digest it. And certainly, we are available to assist you with any questions. Thank you, Joelle, because just for those who are unaware, Joelle and I have been actually doing some statewide trainings on this service navigation worksheet. And the unique piece of this statewide training is we actually include scenarios and examples that we go over to help our professionals actually apply and really think through their considerations on how they may serve a child and family who is in need. So this service navigation training is coming up this week, this Thursday and Friday, if your schedules permit. We would invite you to join to recap some of the information we've already shared, but more importantly, here are the scenarios and examples that Joelle will review that will help you begin to start applying the knowledge that you're getting from this worksheet and how you can best serve children who are in need and their families. So again, Julie, thank you so much. Thank you, Tina, for your comments. The flyer of the training is also in the Google Docs. So again, please consider joining us this Thursday and Friday if your schedules permit. We've got a lot of great information, and certainly we want you to also feel free to directly reach out to us. All three of us are more than willing to hear what you got to say, hear what questions you may have, but more importantly, begin to support your efforts on facilitating the connection and navigating sometimes our complex systems to help the children and families that you all are serving. So thank you so much. All right, Julie, thank you so much for downloading those. Here's our contact information. Again, we've got our great champion of Tina Morgan here in Circuit 9 for Orange and Osceola County. if you're in this county, please reach out to Tina. Let her know that you are interested in this or what questions you may have. She can certainly connect you. And of course, our colleague Joelle is just north of her in Marion County in Circuit 5, and is just a wealth of knowledge and information where we want to share this with you. We want to support your abilities to make a positive difference in the children and families that you serve. And we hope that today, through the information you heard, you got a lot of takeaways. So let me give you 2 quick takeaways for sure that you should hopefully leave with. Number 1, as Joelle and certainly Tina mentioned in her comments in the chat, is that if we need to find a starting point to begin helping a child and family who's got all kind of challenging and complex issues, one of the first things that we can ask is, do they have health insurance, right? Starting with health insurance gives us a framework to be able to work from, because again, the health insurance can provide the dollars that we need to provide services. The second thing that we wanted to highlight to make sure that all of you take away is that if you are working a case situation that is complex and you have done everything you possibly can think of to resolve this issue but have been unsuccessful, you now have a lifeline through a local review team who is willing to hear you out, to work with you in assessing the needs of this child and either providing guidance to further support your efforts or saying, you know what, we are going to take it and begin staffing it through the local review team so that we can support your ability to find resolution to these needs. So again, all kind of great stuff. Those 2 takeaways we hope you leave with today out of anything. Those 2 things can be a lifeline to support the work that you do for children and families. So before we consider wrapping up here, we wanted to again put out a call for any comments or questions. Please consider the chat or the QA tab.
There's one more question, Zach, there's one more question from Lee. What is available if they do not qualify for health insurance? Which was my concern as well.
Yep. So I think Joelle kind of mentioned that. I'm going to try to recap what she says and then ask her to join in. So Lee, again, great question. We talk a lot about health insurance, but we know we have a segment of our population that doesn't have health insurance. So one of the first things that we want to do is help them apply for health insurance. We want to understand what's the reason why maybe they don't have health insurance, and certainly how can we assist them in making the connections to apply for that health insurance. The second thing we definitely want to do is begin to work with our local managing entities, because they are kind of our catch-all, right? They can begin to provide services even though a family may not have health insurance, or maybe awaiting confirmation that they do have health insurance. So our local managing entities play a key role in providing services if you have or don't have health insurance. Joelle, is there anything else to that?
Yes, I do want to add that local managing entity would be your entry point. And so they can help connect to additional services. For instance, our community action teams, our CAT teams, which are a very intensive wraparound service, they don't require insurance for that. So they're funded through the state, which comes through the local managing entities and whatnot. So connecting with that local managing entity is going to be very important.
So Lee, the kind of the step process, it would be number 1, let's contact the health plan. And if they don't have the health plan, let's try to get them connected, but let's then connect with our local managing entity. Thank you, Joelle, for that comment. And Lee, thank you so much for that question. Are there any other questions or comments that folks may have? How about Tina and Joelle? Any final comments before we wrap up?
I just want to say thank you for your time. Again, I know it's a lot of information. I hope you would join us. Check out the flyer in the Google Docs drive, which has the links to register for the training. We walk through it a little slower. We go through examples. So it really builds that practice of trying to use the worksheet. We know there's a lot of information on it, but I really encourage you to take that worksheet, print it out, try to utilize it as you are working with different families, and give us feedback, because we want to continue to improve how we get this information out to folks, and we want to keep working to get it out there because we feel it's needed. It took, like I said, 7 years to kind of really develop a model to this, and we want to constantly improve it and tweak it as we go.
Thank you, Joelle. Tina, we'll give you a shot to see if we can hear you.
Tina is putting some things in the chat.
Okay. That sounds good. Well, thank you, Tina. And again, everyone, thank you so much for joining us. Again, we have 2 more training sessions later this week on Thursday and Friday that will go into more depth around our service navigation worksheet. And certainly, too, if you think this is good information that you would like to have a personalized training for your organization or a group of folks that you're working with that you think could benefit from that, please reach out to Tina, Joelle, and myself. Let us know. We would love to support your efforts and even be able to model this presentation to fit the needs that you may have or the topics that you want to cover. So we are more than willing to do that because we want to get this information out to support our frontline professionals like you who are serving children and families every day in the trenches, to arm you with the tools and the supports that you need to be successful, because your success will roll up and be counted towards the success that we have as a state. So again, thank you all so much for taking the time to join us. Have a great day and let us know how we can serve you. Joelle, go ahead and put up our contact information so folks can have that before we wrap this session up.
Yes, I want to thank Zach Gibson, Joelle Aboytes, and Tina Morgan, the strong silent partner that she put there. Thank you so much for an incredible workshop. I downloaded all the documents. I work with college students, and many of them have children and have questions. And I just think this is such important information because they don't know where to go, who to ask, or what to do. So I sincerely thank you for sharing all this information. I learned so much today on this workshop. There is a Qualtrics survey. We ask you to please complete that, and we sincerely appreciate everything. There is a recording of this session that will be made available to all of the participants at the conference, so you will be receiving this also as well. Thank you again. This was wonderful information. I sincerely, sincerely appreciate it. Thank you so much.
Thank you, Ada.
Thank you.
Thank you, everyone. Have an amazing rest of the conference.
Thank you so much, Zach. We appreciate it. Take care, everyone. Please be safe out there. Bye, Julie. Raquel has a request to have this presented at Early Learning Childcare Providers for her, and she put her website, her link there. Zach.
And Tina is on it. Tina's emailing her right now.
Yep.
Awesome.
Yeah, Tina, I think Raquel's in Orange County.
Wonderful.
I'm assuming.
Thank you so much. This was lots of information, Joelle. You were right. It's just a lot. Yes, she is in Orange County, Zach.
Perfect.
Yeah.
Awesome.
This was great. Thank you so much.
Okay, Ada, I'm out. Good to see you, everyone. Thank you so much.
Thank you. Please be safe.
Keep doing
Take
great
care.
work with children and families, everyone.
Thank you. Yes, those are our future leaders. Thank you. Take care.